Hospital is one of the scariest places for people with Parkinson's to be, according to a new report by Parkinson's UK.
Parkinson's is a degenerative condition of the brain, which is fairly common. So anywhere between 120 to 150,000 people in the UK are currently affected. The condition is becoming more common as the population ages.
The report uncovered how many people with Parkinson's are being subjected to shocking levels of drug deprivation, with many denied regular access to the medication they need to keep the condition under control.
People with Parkinson's take typically 15 drugs a day, but the reality is that people don't understand just how vital the timing of those drugs is. People require those drugs at a fixed time, a set time every day. When people with Parkinson's don't have access to their medicine, it means that they can't move so often. In many cases, hospitals are failing patients. I heard a story recently. They were telephoned by the hospital to say, come and see your mother who has Parkinson's, come and see your mother quickly because she's had a stroke. So she came running into hospital to see her mother and say, no, she hasn't had a stroke, she just hasn't had her medicine. Given her medicine, and within a few minutes, her mother was back to normal and able to communicate and move in a way that she had been a few hours earlier.
And the human cost can be devastating. Patricia McWilliam Fowler's husband Ian was admitted to hospital in 2013 complaining of stomach pains.
Ian went in as a man with Parkinson's and pain. He came out a total wreck, and what happened to him in there wrecked our lives. All of it exacerbated by the fact that Ian was not getting his medication on time. And I begged them to let me give him the medication when I knew it wasn't being given on time. No, it had to be locked away. And the drug round was, I think, either 3 or 4 times a day. No good. Ian needed his medication 6 times a day, and he needed it on time, and he did not get it on time. By this time, he couldn't move, he couldn't walk. And I put him in a chair one day while they were making the bed. Ian slipped and fell and broke his leg. And it was 3 days before that was discovered, and then he was given the wrong x-ray. But he was in such a terrible state by this time. He certainly could barely fight for himself.
Sadly, Ian never recovered his former health and died last year.
Ian collapsed and died in my arms just over a year ago, and he was said to have had an embolism, and because his mobility was quite slow by then. And I know that if what had happened to him in Rochdale had not happened, he'd still be with me today.
It is a real scandal that so many people feel terrified of being admitted to an NHS hospital, but together we can make sure that this is something that is changed. People with Parkinson's are very used to taking their drugs every day and can be part of the solution. If patients are allowed to self-medicate, that will take a tremendous burden off the nurses, but it also enables the person with Parkinson's to be in control. There are pockets of good practice across the UK where hospital staff have really worked hard to listen to people with Parkinson's, to make sure that nurses understand this issue, that they use pill timers, that they allow patients to self-medicate, and then it works really well. The challenge is, why isn't that the reality for everybody?